challenge lies is there's some other what we call PPEs, personal protective equipment, that globally are in shortage. You're talking about special masks, like what you call the N95, other gowns, special medical gowns for the frontline workers, face shields for those persons really up front, and of course testing supplies. That's where we have the big challenge, and it's like a grab. And as you say, as I alluded earlier, all turkey fighting for their own crop, and some big powerful countries have decided that, I mean, they're looking inward first, and that is where we are now. So that's why it's so important that we collaborate with all partners to facilitate a safe procurement for our region. And we are working at it, but it will require the support of private sector who may have good supplies contacts, and of course the policymakers, our diplomatic posting overseas, etc. And yes, the region is working on some in addressing some of those. Over.
Sure. Melinda, more questions?
Sorry, one minute. Yes, I'm here. I'm here.
Okay. Well,
I have a question and a comment, really, from Omati Madre says, hey, we also have to ensure that children are safeguarded from abuse. Jamaica is also providing support to families with children with disabilities. We need to work towards making this regional. I guess her question is, hey, the region as a whole, are they going to embrace?
Can't hear you properly.
Can't hear me?
Yeah, no, we're not hearing you clearly.
Oh boy.
Anyhow, I think I get the gist of the question. The person, I think Ms. Madre, is asking whether enough attention is being paid to abuse of children, and particularly children with disabilities. Dr. Van West-Charles.
Well, I think this is one of the things that we'll have to look at in terms of when we are doing our epidemiological surveillance. And epidemiological surveillance is not only, it should be a robust system. I think, again, and I refer to the issue of the health development paradigm, and what COVID-19 has revealed in many cases is that our epidemiological systems are not robust enough. They are the profile of the persons in epidemiology are not at the same level as our clinical colleagues. And this is because how I think the people in health systems see public health. So I think this is something that is bringing to the fore the reality of a reordering of within the health system as to where public health is. And it is not only for outbreak investigation, it's to deal with planning of the health system, etc. And therefore, in looking at all of these issues with respect to disabilities within the homes, the children, etc., that requires a surveillance system by itself, which should be under epidemiology. So I want to say that it may not be there as a front issue, but it's something certainly that we need to be looking at. And the more we can ramp up the robustness of our epidemiological systems, it will help us to have greater focus across the board, and not only when this infectious disease is over and we relax, then another one comes and then we're stimulated again. And I just want to underscore that in all of the countries, we need to ensure that epidemiology has the profile it should have in terms of the health system.
May I just add to the response regarding the support to families, especially families with children with disabilities? I think the person who asked a question may also be addressing the social dimensions of the impacts of the disease. And even the whole question of working from home or staying from home, there are mental health issues to be addressed. You have issues of abuse, not just of children, but even spousal abuse. These are things that we have been discussing at some of our meetings, and we are working behind the scenes to guide the region as to how they may address them. So children with disabilities, for example, are unfortunately some of the last persons that special attention may be paid to, not only children, but all persons with disabilities. And some member states have been addressing that. They have to use social protection measures to do that. And it is for the persons involved in care of those persons to keep that pressure on the policymakers to be aware of the problem and for all of us to support measures. In fact, the heads have used some of those information to negotiate with the international financial institutions as they develop their packages to address the social challenges. And yes, those are some of the main ones up front, but I don't want us to underestimate too the impact on the mental health of all, even us who probably might think that we are not so challenged. But working from home is not a simple thing. And there are many other issues that arise from that. I can tell you from our staff, there are persons, even when we made the decision to work from home, there were persons who felt it was more convenient to come to the office because there are a lot of factors which we don't have the time to go into here now. But I think it is certainly also about the social impact of COVID, to which that question may have been alluding to.
Thank you very much. I have one last question. Somebody's asking, can we ask the panel if Caribbean governments would be willing to accept donations of medical supplies such as test kits, gowns, masks, N95 surgical masks from the government of Taiwan?
Let me take a go at that one. Very interesting question. For participants, the situation is a fairly delicate one. Several of the CARICOM member states, most of the CARICOM member states have diplomatic relations with mainland China. Some of them have relationship with Taiwan. We don't have to go into the details because I assume that the person who asks and most of us may understand the challenges here. You may have already read about an interaction with an official of WHO and Taiwan reporter. In these special situations, our leaders are aware of that, and my understanding is that if anything is offered, they are willing to give consideration to working with anyone despite these underlying diplomatic or ideological challenges. I can assure you that the Embassy of China to Guyana has been engaging with us at the Secretariat. We have worked with them discussing aspects of the disease and possible responses. I know that some of our heads who have diplomatic relationship with Taiwan are aware of the very question. I cannot at this point state that I know for sure that any offers have been made by Taiwan, but I believe that if such offers are made, the heads will look at it in a very mature way and will make a decision in the interest of the citizens of the region. I would say that any such offers by either China or by Taiwan must be understood that it should be to the benefit of all CARICOM territories, despite their whatever relationship they may have with either of the two arms of China, if you want to say that. So it's an interesting question, and it's something that I will certainly raise at our executive management level, and which can then get it out to the policymakers. Over.
Okay. I gather there are no more questions, so perhaps at this point we can ask each panelist to give us a wrap-up. But before I do that, Eldon, you mentioned the possibility of and I think you said a 2% tax or something that would go specifically into some kind of fund to guard for rainy day for workers who might be displaced in the tourism industry in the future. How open you think would be hotel chains and the cruise ship industry and so on to that kind of tax?
It's not a tax. The 2% of their revenue set aside as a reserve, as they do for like replacements, like capital replacement and revenue placement. But it's just a 2%, and it's not just putting it in a reserve. It must be backed by an investment, a risk-free investment, and this can build up. And the disaster would also cover things like that fund would also cover things like the employees, the situation they're in now. You'd have something to draw down on to the employees. Because most especially startup companies, they have like a 5% reserve for replacements of fixtures, fittings, bedroom linens, etc. This is just a 2% of revenue off the top, but it must be allowable by the income tax authorities. It must be tax allowable to make it, to make it kind of beneficial to the organization.
Mr. Samaroo?
On a sum up, on a wrap up, or
no? I thought you wanted to address the issue of
a comment on that.
Okay. I think it's a good idea. However, it's how these funds are managed and the whole framework that needs to be established to manage it, and how it impacts on the overall cost structure of our tourism product. Well, I think it's a good idea. I'm a believer in creating contingency funds for whenever that contingency would have arisen. But the key to it is the framework of how it's established and how it is managed.
Okay, and as we have you want to give your wrap up?
Yes. I believe that COVID-19 has brought the reality of how fragile the Caribbean is as a region, as close as possible as you can get to home. And I believe that this opportunity must be taken for us as a region, whether we are government, private sector, civil society, whoever we are, to sit down and work on modernizing our society, on taking strategic steps that ensure that our region is self-sufficient in areas of food, to ensure that the people of the region are better educated in today's world driven by technology. I see technology in a wide context of modernizing our society. because everything, every aspect of life is driven